Hey everyone, thanks for joining me to talk about pain. And I recently took a great course for postpartum health for women. I felt that this was a weakness in my education, and I was so impressed with the course and the instructor. I decided to ask her to be on my show. So here she is. This is Lynn Schulte. She's a women's health physical therapist for over 30 years and the founder of the Institute for Birth Healing. She's been helping moms heal from all the issues women experience after birth and is now teaching courses to body workers to help them do the same. She found a common birth pattern that shows up in the pelvis after birth and knows how to effectively release these patterns. I found that part of her course fascinating and incredibly useful. Knowing we are more than just our bodies, Lynn works on all levels, physically, energetically, and spiritually, with women to help them access their full potential. She also teaches body workers how to work with the energy of the body and how to assess and use your intuition in your body work sessions. She offers a certification process to help birth professionals become birth healing specialists. Lynn holds a Bachelor's of Science in Physical Therapy from St. Louis University, St. Louis, Missouri. A true teacher, Lynn continues to supplement her professional experience with training to complement and update her practice. And for those of you who aren't body workers, females who have had children or are about to have children, I think this is an incredibly important episode for you to listen to, as you are part of a very much underserved and underappreciated population out there. If you look in the notes below, you'll see a link from Lynn to a YouTube video to correct a common problem with the pelvis after giving birth. So please listen to this show. I think you're going to get so much out of it as I did, both as a practitioner, but also especially if you have had children or are about to have children, and because there's so much that goes undetected until later on it rises as pain, and it can be helped right off the bat by someone as special as Lynn or the people that she's trained. So without further ado, let's get started. Okay, everyone, I'm here with Lynn Schulte, and the reason I asked her to be on my show is because I just took her course, and it was just fantastic and very intuitive, and I feel much simpler than what I've been taught in the past as a physical therapist. And you even mentioned that in the course, Lynn. All of the muscle energy,
Yes.
techniques and orientations, so
Is it
forth. So
is it left on left, right on right?
yeah,
Do I lift my
ex-
knee this way or that way? Or,
yeah, right. One of
darn
the main reasons I never pursued manual therapy. I thought, I can't get all this stuff. This is ridiculous.
well, it just
So
it
anyway,
my brain hurts, right? To
yeah,
think so hard.
yeah. Well, thank you for being on the show,
Thank
and
you for having me.
oh yeah, it's a great course, and I feel it's such a needed. Your area of expertise is so needed out there, and my understanding of it is much more simple than yours. So why don't you tell us a little bit about who you are, what you do, and how you got into the specialty?
Okay, so been a PT for over 30 years. I think I've pretty much done every aspect of PT except for peds. Never worked with babies, but I was an athlete growing up. I thought I would love orthopedics, but went into the nursing home and loved that just as much. So have a wide range of background, and seeing where I'm at today and being able to look back on it, I go, wow, all those continuing education courses that I took along the way were perfect for where I'm at right now and what I'm doing. And, I have background in craniosacral and visceral manipulation, and I took Jerry Hesh's courses on the pelvis. And that was back in 94. And I just like, oh my gosh, this is so easy. Like if you really enjoyed the pelvic mechanics that I talk in my course, some of my techniques are based off of his teaching. So the heshinstitute.com, he's got 16 different patterns he finds in the pelvis. And it's not about feeling the motion, it's about feeling the restriction and treating the restriction in the bone. And he was really instrumental in helping me to feel that bone can be hardened, and bone, like when there's injury to the bone, you can feel like bones has a natural give to it when you compress it. And he was like compressing the long bone of the femur. And and I was like, oh. And so I just took that and started compressing everything, Rick. Like, if it's soft on one side, it should be soft on the other side. So let me see, okay, what's hard over here and what's soft over here, and it should be like this. And then I just started feeling with my hands and really listening to the body. And I was doing women's health I lived in Seattle, and then in 2008, we moved here to Boulder, Colorado, and I had to start all over again. And that's when I just started working with postpartum clients. And I realized that all the courses I had taken up to that point, like I could all apply to the postpartum population. And when you only see one population, like I was only seeing postpartum moms, that's when I started to discover that their pelvis is twisted the same way. Everybody that laid down on my table had a rotation to the left of their pelvis. And then I just got curious with it. Like, what's going on here? And that's when I discovered that the sacrum was off. The sacrum wasn't moving well in that right SI joint, and that there was a shear pattern going on. And that's what was creating that rotation. And really fixing that shear was when people would go, my gosh, I've been seeing chiropractors for months and massage therapists for months, and the right-sided low back pain wasn't going away. And in 5 minutes, it was gone. And I was just like, cool. And then I just started noticing all the other patterns too. And it's like, oh, sometimes the liver gets jammed up or the stomach gets jammed up from carrying those babies, and the baby's using it as a punching bag with their feet or their butt or whatever it is. And having women come in and saying, I can't take a deep breath. And then feeling into that and noticing that, wow, they're jammed up. Okay, let's help them bring it back down. And I had a mom with twins who carried twins, and the one baby was right across and underneath her diaphragm, horizontally there. And she, for 2 years, couldn't take a deep breath.
Wow.
And I just helped her, bring the liver, stomach back down, release the diaphragm. And I saw her the next day and she was laughing. She goes, Lynn, I can't believe I'm not hyperventilating because I can finally take a deep breath after 2 years, And I've had women fly in from California and other states because they can't take a deep breath, and the MRIs and the CAT scans and the x-rays are all negative because it's all soft tissue. And
Yes.
doctors don't know what to do with that. And
Right.
so, I think the key to my success was really just working with that one population and not seeing women from all spectrums of the life cycle, but we do know once postpartum, always postpartum. So I was surprised when I was working with all these postpartum clients, the young ones in their late 20s, early 30s coming in to see me. And then I went home and I was working on my aunt who had a 47-year-old son who was finding the same pattern in her pelvis. And I was just blown away with that. And then I, talked to her about it, and she had a horrifically traumatic birth with her first son.
Wow.
And then I was like, whoa, the pelvis can hold on to this that long?
Yeah. Yeah.
It's so true.
So, Lynn, regarding that particular case, did it take 47 years to correct this 47-year-old problem?
Rick, it does take longer. It does take longer. Unfortunately for my aunt, I don't live close to her. So I only treated her like once or twice, and she has zero pelvic floor strength. Her pelvic floor doesn't turn on at all. Like, she has no connection to it. And I unfortunately wasn't able to make that much of a change working with her. But I do have to say, in my other clients that, I'm now seeing my clients' moms. They're coming in to see me because they have hip pain, they have stress incontinence, they have prolapse, that they've just learned to live with, right? And there was one woman that I remember working with, and her pelvic floor muscles just felt like cardboard. Like they didn't have that, normal muscle is this quick on off on, should be able to contract and then, turn off. And hers were kind of like, I think I can contract. I think I can release. And once we got her bones back into place, they turned on and off, on and off.
Okay.
And,
Isn't the body amazing?
it is, yeah. And she was in
Yes.
her 60s.
Wow.
So
Wow.
it had, her pelvis had been stuck open. I'm calling it the open birthing pattern.
Hmm.
Pelvis is stuck open. It does not always come back together.
Yeah. So, folks, those of you listening, Lynn is just amazing at what she does, and it would be really helpful. I know you have a model there,
Yes.
so I would love. Why don't you just mentioned this open birthing pattern? Why don't you show us what that is?
So let me explain what happens to the pelvic bones as a baby comes through. Okay. So this right here is the pelvic inlet. And so for a baby to come into the pelvis, the bones need to open up this pelvic inlet. So the sacrum actually, let's see, how can I show this? The sacrum actually needs to tilt backwards so the tailbone comes forward, and then the ischiums come together and these iliac crests come out to the side. All of that makes this bigger for the baby's head. And then once the baby comes through and it hits these little bones right here, your ischial spines, that's where your pelvic floor muscles attach in. And when the baby's head hits the pelvic floor muscles, that's a sign to the bones to go the opposite direction. So instead of doing this to open up the inlet, now we're going to open up the outlet, and the tailbone goes backwards. This is called sacral flexion. And then the ischial bones splay out to the side. Do you see how that all opens up the pelvic outlet for the baby to come on out? Well, this is the position that some women are stuck walking around in.
Got it.
And the other thing is that if we have tight pelvic floor muscles, let's say this side is really tight, these muscles aren't going to open up as much, and now this one might. So now instead of, having this nice opening evenly, we may have one side open more than the other. We may have another side that opens up. And so these are the women that are complaining of, well, I don't sit like I don't feel like I sit evenly anymore. Well, you don't. Because
Yes.
your bones aren't in their proper place. And it's just interesting to bring these bones back together, and people are like, oh, I feel like myself again now.
Yeah.
And imagine, Rick, what happens when these bones are splayed and open like this. The pelvic floor muscles that attach here are on stretch, and they can't function well. And one of the key pieces to know if your bones are still open is if you go see a pelvic floor therapist and you're having pelvic pain and they release the muscles, but they don't address the bones, your pain's going to get worse. Because your muscles are trying to hold your bones together.
Right.
To keep you stable.
Yeah.
You take that out of the equation, now you're more unstable and you're going to have more pain.
Yeah.
And one of the big things that I teach in my courses is like, we have to, if we're doing intravaginal work, if we're working on the bones of the pelvic floor muscles here, you see how they attach, here's those sit bones, here's your bone. If we're addressing these muscles, we must address the bones first. They need to be put back into place after birth. Even after a fall, Rick, someone falls and jams this up, it could be jammed out to the side. It could be jammed in. That could be causing a lot of sacroiliac joint. These bones here down at the bottom, if they're too far in, it could put strain on the sacroiliac joint, right?
Yes.
Everything's connected.
It's amazing. So in your experience, do you find that once you restore the bony alignment, the symmetry, that the muscles then can function better, and that's why you're doing it first?
Absolutely. It's the housing of those bones, of the muscles. And so it's the foundation. We've got to get that foundation settled, and then the muscles can relax. Now, the other thing with a vaginal birth, and even with a cesarean birth, the organs of the inside, these guys get all out of place. So they get smushed off to the side as baby's coming through. And I had a fun client come in one time. I saw her a second time and she goes, I went and I told my friends, you like get in there and you rearrange the furniture. I'm like, oh my God, that's exactly what I do. You're right.
Yeah.
Because as the baby comes through, the bladder gets smushed off to the left. We can find the cervix anywhere internally. And if those structures can't move freely, intercourse is going to be painful and the pelvic floor muscles are going to be activated. So in my postpartum course, I do teach kind of this protocol or this way of working with the postpartum body. First, we need to get the bones back into their happy place. And then we do this internal protocol where we first assess the pelvic floor muscles, and usually they're not functioning fully. And so we just assess that, but then we go and we work with the bladder and get the bladder back into place. And then we get the cervix back into place and we get it moving. The cervix internally should be like a piñata. It should be able to move freely in there. If it can't, thrusting with intercourse is going to be painful because it's going to hit a structure that can't move. That's why it needs to be a piñata, to be able to move up and out of the way for thrusting to be comfortable for someone. And I was just teaching this weekend in Portland, and one of the students, we were doing the intravaginal protocol, and one of the students was like, I'm not quite sure what I'm feeling. And so I went inside, and instead of the bladder being this saggy, it's like this mushy tissue, that's healthy bladder tissue. Hers had this strain pattern on it. It was just taut. And then her cervix didn't move at all. And I said, how's intercourse for you? And she goes, oh my God, I hate it. I go, well, of course you do. Your tissues can't move. Nothing can move in here. And so we released it and got things moving a little better. And she reported back that things were better, but not all the way there yet. So I told her to keep working on it and that we could address it in September if she hasn't figured it out by then when I go back to teach the pregnancy course. But it just is so important. The bladder and the cervix need to have free movement in there because all those tissues actually expand and contract. Everything in our pelvic space, the bowel, the uterus, and the bladder are all structures that are meant to fill and empty. And if they don't have that free mobility to be able to expand and contract, it's going to cause problems. And a lot of times after I get the bladder back in and get the cervix moving and I go back down to the muscles, they're much better. And then there's much less work that I have to do.
Yeah. So Lynn, to stay on this idea of the open birthing pattern,
yes.
Okay, what types of symptoms would listeners have that might indicate that they have an open birthing pattern issue?
Yes. Okay. So when if sitting feels different than it did before you had a baby, or you feel like you're sitting cockeyed, like one sit bone hits more than the other, you have more pressure on that. That could be that one side is more splayed. Your pelvic floor muscles don't have good strength. They should, normal pelvic floor muscles should be, I think of it as an elevator, should be resting at the ground floor, should be able to contract all the way up to the 5th floor and then rest all the way back at the ground floor, and then even have the ability to come down into the basement. So that's normal strength and function of the pelvic floor muscles. If your bones are kind of open, you're going to have diminished ability for those muscles to fully contract and fully relax because they're like a tightrope now. Penetration pain. So with those muscles on stretch, now the muscles can't, expand even more to allow penetration. So that's something that's going to be a problem. A lot of times, Rick, the open birthing pattern, you may not notice it for years until you get pregnant again. And now you have pelvic pain. Okay. So I always ask my pregnant clients that come to me that have pelvic pain and it's a subsequent pregnancy. I always ask them, did you have this pelvic pain in your first pregnancy? And if the answer is no, then I know the pelvis is still stuck open. And when you close the bones and get the bones back together again, that pelvic pain goes away instantly. Okay, so it makes sense if the bones are kind of open in this unstable position. A lot of times after a baby comes out vaginally, Rick, there's no sense of normalcy again, right?
Mm,
Bones have been opened up and we don't really know what is normal or not. So unless someone is in pain, having back pain, pelvic pain, that could be a problem. We have an open birthing pattern.
mm.
We have tension in the pelvic floor muscles. That could be a sign we might still be open. But if we don't have any of that, and now we're going and we get pregnant again, and now all of a sudden we start having pelvic pain, back pain, and issues we didn't have in our first pregnancy, that's a sign that the pelvis is still in that open birthing pattern.
I
And
imagine. Oh, I'm sorry. Go
go
ahead.
ahead. Go
I,
ahead.
I imagine, gosh, if they're stuck in that open birthing pattern, then when they're having their next child, those bones aren't able to go through the first phase of closing that to open up the tops of
Yeah,
of the ilia. Does
yes,
that happen or no?
not so much, not
Uh
so
huh.
much, because the pelvis is so, the pelvis has so many ligaments trying to keep it held together. The pain that they experience during the pregnancy is, it's open, so this is it's a little more unstable of a position, and then you add the laxity from the hormones, and that's what starts creating all that pelvic pain, because
Got it.
ligaments do an amazing job of stabilizing our pelvis as best they can. The pelvic floor muscles try to help out as well. And so a lot of women could be walking around and not even realize that they have this open birthing pattern until they get pregnant again. And now we're adding the increased weight and the laxity from the hormones that
Got it.
create all that pain. The pelvis, typically, if baby gets into a good position, that second birth is usually quicker than the first birth. So I don't think it's not significant enough to impact a baby's ability to come in and stop that, Rick. So
I see.
yeah, it's more a stability issue, that they're just not going to feel comfortable walking around and moving around and bending forward, because the sacrum needs to be able to move and extend for flexion and extension when we bend forward, when we straighten up. And if it's trying to stabilize, that back is not going to be happy when we're doing all those motions, because it's in this stuck sacral flexion pattern.
Hmm.
So instead of being here, the sacrum is now here. That puts a lot of strain on the anus. So if you see from here, the anal sphincter muscle, if this is pulled backwards, you
Yeah.
have a
Yeah.
lot of tension and tone on that anal sphincter. And Rick, I have to say, this muscle right here is so impacted by the way babies come on out, because it gets so stretched out, and the baby's head and face even come through and just stretch this tissue out. And then if the bone is still stuck in that open position, there's a lot of posterior tension on the anus here. So people dealing with hemorrhoids or fissures, that they need attention in this muscle. This muscle
Wow.
must be addressed in every postpartum client. So important. So.
Yeah.
And then think about the tearing that happens. Sometimes, most of the time when people tear, they tear down in this lower quadrant here, either off
Uh-huh.
one side or the other. And if it comes down into that anus, anybody, that's a stage 3 is when the tearing enters near the sphincter muscle, and 4 is when it goes all the way through. Anybody with a grade 3 or 4 needs to get pelvic floor therapy done, ideally with someone who's trained with me, who knows how to address the bones first and knows how to release all that pattern from this area. It's so critical.
I would imagine. I mean, is the typical treatment for that is that they stitch it up, and
Yes.
then is there typically rehab
No,
suggested after that? No, because they just assume, well, that we stitched it up, good to go.
good to go. But I tell
Amazing.
you, yeah, it's crazy, crazy.
Yeah.
Rick, it's also crazy that we cut through 7 layers of abdominal tissue to get a baby out, and there's zero rehab for moms,
Zero. Yes.
zero in the hospital. I mean, our gold standard should be OT and PT for everybody who's had a cesarean. That should be the gold standard. But if you go get a, laparoscopic or any other abdominal surgery, you get PT and OT.
Mm,
Why not
yeah.
when you have a baby?
It's wild, isn't it? That's just crazy.
So here's the thing that happens in the hospital is that women have cesareans and then they're sitting with their bed up because they have the electric bed, right? So they can
Yeah.
raise their bed, and now they're sitting in this crouched position and they've got bed rails on. Okay. And they're taking care of baby and they're in this position. They haven't really stretched out their tissue to lay flat, nor have they learned how to get out of bed without bed rails. And then they go home on a very flat bed with no bed rails, and they have no idea how to get out.
Wow.
And then they break open their stitches, their wound, opens up because they're straining that area because nobody taught them how to get up and out of bed properly.
Yeah. So in that situation, would you counsel someone to have a progressively
Yes.
flatter
Yeah. Is after
back?
surgery, you need to spend 20, 30 minutes a couple of times a day lying flat
Hmm.
so that your tissues don't heal in this shortened position. So that will help. And then in the hospital, they need to be teaching people how to get out of the beds without using the bed rail because they don't have
Yeah.
it at home. And
Yeah.
and then, all the body mechanics. I mean, think of what we've learned in PT school. We can so help our moms learn how to activate their core and lift those car seats and how to carry baby and all that kind of stuff. It just needs to become the standard of care in the
Yeah.
hospital.
I
That's
agree with you. It's such an underserved
yes.
population. And it floors me that it is so underserved when so
Yeah.
many people are going through this experience,
I know. Rick, we have over, I forget the numbers because it was a while ago that I looked at this. It's either 1 or 3 million cesarean births a year. And nobody's getting that. I mean, now we're making progress, and in some hospitals it is a standard of care. It needs to be in every hospital. But we have, only 400,000 total knees, total hips a year, and they get PT twice a day.
Right. Yeah.
Think about what, that
Yeah.
it's such a disservice. But, just like you said with the tearing to the anus, you would assume that it needs to become a standard of care. Anybody with a grade 4 tear needs to be automatically referred to a pelvic floor physical therapist and seen to have that tissue worked on. Scar tissue does not form as well as normal tissue. It's more restrictive. It doesn't have the flexibility that it needs to. But with massaging, but with body, manipulation of those tissues, we can get it more flexible.
Yeah.
And that's what it needs. One of the big things I want to talk about is fissures. Okay. Because this is, if anybody is not aware of a fissure, it is where, your anus is a circular muscle that needs to open 360 for the stool to come on out. A fissure is where we have a tear, an open wound inside the rectum, inside that sphincter area. And what's happening in my mind is that we have knots. And remember, I said that this area of this muscle always has knots in it post-birth, and sometimes multiple knots in it. Well, if this knot here is stuck and it can't open, so the knot's here, it can't open. So then this side has to open up more. This is where the tear is. And if we don't address the knot, every time you have a bowel movement, you're ripping open that wound. And it's like pooping glass. It is so painful. Some people experience chills. They get drenched with sweat. They shake after having a bowel movement because it's so flippin' painful. And nobody is addressing the muscle. And that when you can release the knot here, now the whole tissue can expand evenly, and we take tension off of that wound so it can heal. And
Oh,
usually before I started doing this, it would take that months and months and months to heal a fissure. But when you know, and then I teach my clients how to release this muscle prior to each every bowel movement. I had one gal, and it was only one, but she healed her fissure in 1 week. It is so amazing.
it is amazing. And folks, you know, while the subject matter may be a little uncomfortable for some of you, if you, I really hope if you're just listening, please watch the video so you can see Lynn's demonstrations of the mechanics of this issue, because she's really demonstrating it beautifully. And those of you who do have, you know, pain, you know, going to the bathroom, this, I mean, there's help. You can get
Yes,
help for this, you know?
absolutely. Yeah.
Yes.
And not many people like to talk about it, right?
Right. Right.
And so, yeah, I appreciate, I know you didn't think we were going here, Rick, but
That's okay. Anywhere you want to go.
but
So
yeah, go ahead.
go ahead.
Now, there's just so many changes that happen to the body after being pregnant, after having a baby, no matter how that baby comes on out. And, let's talk C-section scarring. We talked about the scarring in the anus. When we have C-section scarring, that lower abdominal tissue, some people might experience pain right away from the scar tissue kind of pulling that tissue, but others, they don't develop symptoms till 10, 15 years down the road, where now they start having back pain. They start having bladder frequency where they feel like they have to pee every 20 minutes. They start developing deep thrusting pain with intercourse. All three of those things are from that scar tissue. And by the time they develop 10 to 15 years down the road, nobody's thinking about C-section scar tissue. And
Yeah.
so if you've had a cesarean birth, you need to massage that C-section scar to prevent those things from happening. And it's never too late to start massaging that scar. But the back pain, the uterus is meant to, the sacrum moves forward and backwards, like I showed you. And the uterus has ligaments that attach to the sacrum. And if the uterus, because it's got, the uterus is here, and this is where they do this, they cut the uterus open here. Actually, here's the end of it. This is the uterus, and the bladder sits right underneath it. I have that wrong. Sorry, there we go. So the uterus is big, they cut into it, that creates scar tissue, and it's near the bladder. So now that scar tissue forms everywhere and anywhere to help it to heal. So now the bladder tries to expand to hold more urine, and it hits the scar tissue. That sends a signal to the brain, I gotta go. And then 20 minutes later, that same scar tissue is inhibiting this bladder from expanding fully, sends a signal to the brain, I gotta go again. So we can get in here and we can, massage this and free this up so that that bladder can expand fully. We talked about thrusting, right? If we have scar tissue here anchoring these two together and we're trying to get those tissues to move, they're not gonna want to move. That's going to create the deep thrusting pain. This uterus attaches into the sacrum, and this all needs to move as that sacrum flexes and extends. And if it's too tight in the front, I've never met a C-section scar that's not tighter on one side more than the other. And that doesn't allow that sacrum to move freely in the back. That creates that back pain. I have a girlfriend who has the same age boys as I did. And this was back when they were in elementary school. And so they're like 8 and 6 at the time. And she was getting ready to go camping, and she hurt her back and, was thinking she wasn't going to be able to go camping. And she came to see me, and all I did was work on her C-section scar. And she got off the table and she no longer had back pain. She was able to go camping the next day. 2 years later, same scenario, getting ready to go camping. I think she has an issue with camping, but she doesn't want to admit it. But getting ready to go camping, her back goes out on her again. Well, this time when she came to see me, I had remembered she had knee surgery. She had an ACL repair. So I'm thinking, oh, she's been hobbling around on a bad knee for 6 months, So I adjusted her pelvis, I adjusted her sacrum, I adjusted her knee or leg and everything else. And I ran into her the next day at a school picnic, and I asked her how her back was. She's like, no, I'm still having pain. And it dawned on me like, I never worked on your C-section scar. So I laid her down on the picnic table and I released her C-section scar. She got up and she had no more back pain.
Yeah.
And I was just like, Lisa, you need to massage this more. You need to get in deeper, make sure this tissue stays loose. And I ran into her, I told her, 6 years, I'm like, Lisa, I tell your story all the time. And she goes, tell him it works. Whenever she gets back pain, she does her massage and then the back pain goes away.
Yeah. Yeah.
And by the time you start getting problems, nobody's thinking about that.
Right. Right. And also it could be, in my way of thinking of things from more of a systems standpoint,
Uh-huh.
it could be that she has so many other systems issues that is the camel that's breaking,
Yes,
the straw that's breaking the camel's back. And so by massaging that, you're bringing her back down below that critical threshold of pain. She may have other mechanical issues that are pushing her up to be so sensitive with that scarring as well.
absolutely. And Rick, she is a very short, well-rounded person. And so it's really challenging to get as deep as she needs to fully release and
Yeah.
get to the tissue mobility. I
Yeah.
think to fully like get her over the hump. But yeah, I totally agree with that. And
Lynn, I mean, talking to you, I, I don't understand why there aren't more specialists like you. And seriously, it's such a needed service. And then also, why wait until you have a tear, an anal fissure to see a pelvic? It seems like every woman who has had a child should immediately see a postpartum specialist.
do you realize, Rick, over in France, women who've had babies have 8 physical therapy appointments guaranteed by their government,
Wow.
paid for by their government, because they honor the woman, they honor that, the process. And I think, they're definitely more into, taking care of their women.
Hmm.
And
Yeah.
it becomes standard across the world, really. But I would say, when you know what to look for and how to release these patterns, yes, 8 is great, but we can get, I've been able to get women out of pain in one session, Rick.
Yeah.
And,
I believe it.
and while, getting them out of pain is only one step of the rehab process, because we need to understand that carrying that baby, the expansion of the abdominal wall, being pregnant, really does change the way that our core can function after birth. And one of the big issues that postpartum clients have is the inability really to contract and use their lower transverse abdominis muscles effectively, because their upper abdominal muscles don't get as stretched out, so they stay a little bit stronger. And unless someone has learned and kept their transverse abdominis muscle strong throughout their pregnancy, then their postpartum rehab, their upper abdominal muscles are trying to just keep them stable. The abdominal muscles are really meant to stabilize our spine while we move and do things. And in a lot of postpartum clients, that's not happening. And
Yeah.
so they don't have that stability to really activate their core in what needs to be a reflexive way. It needs to just, your belly, and one of the great tests to know whether this is working or not is to just put your hand on your lower belly and cough.
Hmm.
To see, does your belly go out or does it come in? And a lot of times postpartum clients, it's going out. So their core is not reflexively engaging and drawing in like it needs to stabilize when they go to move and exercise and cough and laugh. And that outward motion also puts a lot of pressure downward on the pelvic organs, which can cause stress incontinence and can lead to prolapse too. So getting the core back into action after birth is really critical for anyone who's had a baby, whether you have issues or not, whether you're in pain or not. You need to make sure that your core is able to activate in a good strategy, in a supportive strategy to your pelvic organs, And we also need to make sure that it gets to that reflexiveness again, where it turns on without you having to think about it. That's my goal with my clients. And
Yeah.
I used to just like, oh yeah, I can get you out of pain in one session. You only need to come see me one time. And while I can get them out of pain, we don't get their core working better. And then I see them 6 months, a year later, and now they have other issues.
Hmm.
And so I've
Yeah.
really kind of changed. Yes, I can get you out of pain or you get your symptoms gone in one session, but I want to see you until your core is reflexive again.
This is one of the things I loved about your course, Lynn, is that I learned so many new things
Oh,
that are really, this whole postpartum issue has just been this mysterious black box for me. I'm just like, well, I know there's probably something going on here, but I don't know even how to assess it. And what I loved is that your course was just so methodical and taking us right through everything, and the ease of understanding what to do about it and solve it. From and in addition to, like, for instance, I've seen that flared rib cage so many times. I'm just like, yeah, but how do I fix this? I know this, and you show how to fix that and get the core activated and bring the stomach down and put the liver in place. I'm just like, I didn't know you could do any of this stuff. This is amazing. So it was a really fantastic course, and I think your manner of teaching and presentation is like this episode. You make it sound simple and accessible for a lot of people, and it is simple and accessible for a lot of people. They just need to know that it can be possible,
yes.
that they're worth paying attention to. Their symptoms are, it's not normal to be in this kind of pain or have these types of symptoms, and that things can change. I've just loved your information so far. Yeah,
Thanks.
it's just
Great so
fantastic.
much.
So I wanted to go on. There was another birthing pattern. I think you called it the common birthing pattern. We
Uh-huh.
haven't discussed this yet. And
Yeah.
I think this is another really important one to touch on for our listeners. Can you describe what this is?
Yes. So it's really the sacral position here. And Rick, I want to say that I have found this in non-pregnant people too. So
I
the
bet.
common pattern, I think what happens is something, I'm wondering if it has something to do with the way we drive, and that and then during pregnancy, during the birth process, it just gets like overly jammed in
We
there.
can chat about that, Lynn, because I have theories myself.
Awesome. Awesome. Cool. Okay, great. So remember, we talked about how the sacrum needs to come backwards in order to open up this pelvic outlet.
Mhm.
Well, one pattern of the sacrum is that it does stay in midline as it comes back. And this is just a true sacral flexion pattern. But another problem is, let me think here. This is right, correct?
Yes.
The sacrum gets jammed over to the right-hand side like this, okay? And so you can see now the tailbone is no longer in the midline, and the sacral base here is higher than on the left. And
Right.
this sacroiliac joint does not move as easily as on the left side. So
Mhm.
this is the pattern that I first found. And this is what, being like this is what actually caused the pelvis when they laid down to roll like this.
Mhm.
Okay. And so we need to, in order to treat this, we've got to help bring the sacrum down. We've got to mobilize it anteriorly. We've got to pull it down, and then we have to shear it over to the left-hand side. And
Mhm.
that shear is the biggest piece to that puzzle, and getting that sacrum back into more of a happy position. So this sacrum and this in the sacroiliac joint can function better
Yeah,
fully.
and folks, your spine, of course, is resting on top of that sacrum.
Yes.
So if the sacrum is cattywampus, then your spine's going to be cattywampus too, right?
Right. Yep.
Yeah.
Absolutely. And then, these bones here, we call them PSISs. These are where the dimples in your low back are.
Mhm.
Some people will have dimples right where these bones are. Well, these can get splayed out too. So another pattern that we didn't talk about, Rick, is that the entire pelvis can get splayed apart, and the
Wow.
sacrum gets pushed backwards. And so now this is when, a baby comes in, typically, it comes in a different, like the head's asynclitic. The head
Mm.
comes in cockeyed. It comes in posteriorly. So usually baby's head, if this is the baby's nose, the baby's head comes in sideways here. And
Uh-huh.
the smaller part of the baby's head comes in first. Sometimes the whole head comes in, and that's what can create this expanded or posterior sacrum, as we call it. And then there's zero mobility in these joints. It's like they're on stretch.
Right.
And that's going to create a lot of low back pain,
Oh
instability.
my gosh. I can't imagine.
Yeah, yeah. So, I think the biggest piece I want people to understand is that the bones of the pelvis go through a lot to get a baby out, and
Yes.
they don't always come back together. And
Yeah.
sometimes we need help. And one thing I do want to mention is that for this open birthing pattern, I have a video on YouTube. Maybe we can put that in the show notes,
Of
Rick.
course. Yeah.
YouTube on an exercise to help bring these bones back together again.
Lovely.
And so you can do it's using the adductor muscles that attach into here and the abductor muscles of the hip to help try to bring these bones back together again. And if moms can do this right after birth, it can just help bring
Oh
things
my gosh.
to a more midline position. Okay.
Yeah.
So there's on my YouTube channel, there's how to close the bones after birth, I think, or something, but we'll put a link to that video in the show notes. Okay.
Most definitely. I can't imagine a better Mother's Day gift, folks, than sending Lynn's links to your mom.
Yes. Well, and what I want people to know is that I do have a directory of people that I have trained. And Rick, I hope you're putting your name in there after learning the postpartum course material. The directory is people that have taken my courses, so they understand and know about these patterns in the body, and they know how to correct them. So please check that out. It's on my website. So instituteforbirthhealing.com is my website. And there's a directory up in the menu bar. Just click on that and hopefully there's someone nearby. Unfortunately, we haven't been able to get all of our therapists that we've trained to get a directory listing because they're already so busy, unfortunately, right? So we need more. And I'm not done training until, I would love to have someone who knows this material in every city in the world that knows how to help a mom heal after birth.
As it should be, as it should be. And to be honest, Lynn, I did not sign up for that director's because I don't want people to think that I'm proficient at this. And also, if you think that you want to see me about this, well, now that I know that you're just a hop, skip, and a jump away, why don't you just go to the source instead of seeing me and just go see Lynn?
Yeah, well, and Rick, didn't you find though that some of those techniques that you learned in that course are applicable for anybody?
Oh
Right?
my gosh, this is what I loved about it. And so, are you okay on time, Lynn?
Absolutely, yeah. Absolutely.
Okay. All right, because a lot of your release techniques, I mean, clearly you're targeting fascia constriction, and so can you speak about a little bit about what fascia is and how it is important in solving these problems?
Well, fascia is a connective tissue in our body, and it goes around every muscle, every organ, and it's this, and it's such an alive part of our body. Like it's got an intelligence all on its own. I mean, fascia is amazing. I would say that what I think I've done with this body of work is really to really be able to learn how to listen to the tissues. And whether it's a fascia restriction or it goes down to the bone, it's being able to, and restrictions in my mind loves compression. Like we engage the tissue, whether we're engaging muscle or fascia or bone, we're engaging it and trying to, I feel like bringing it together is, the great analogy I love using is, those glass doors on a cabinet that have magnets holding it closed? Well, you have to push in to get it to pop out, right? And
Mm,
that's what I feel like we're doing with these tissues and with the bones. And the bones love compression. They love to come into it more in order to release and come out. Fascia loves to be taken into its restriction pattern, and then it softens and it lets go. And so, a lot of the techniques that you and I have learned in our past is, well, first you've got to do this motion, then this motion, then this motion, and we need to apply to the body this what we think should happen. And really what I've done is just like, let me engage this tissue and let me just follow you and see what you want to do. And it goes into, so
mm,
basically the body is way more intelligent than you or I, Rick. we
yes.
we need to understand that, right? And so let's engage that tissue and let's follow it and let it do what it wants to do. And as I'm doing that, I'm also really tuning into my own intuition and to that inner voice telling me, maybe if you compressed here, that might help. Maybe if you put it in this position, that might help. And so I do like to, when I'm working with postpartum clients, I always want to know, what position were you in when the baby came out? Because that's going to tell me, the impact on the pelvis. If someone was in left side lying, their right ischium is going to be way more splayed than their left, because this is
Mm,
anchored. If someone was squatting, but they had their right leg up, then I know that there's going to be a torsion. There might be a torsion on this. So I'm going to go look for that. You
yeah.
know, I had someone in one of my classes that had right side adductor tension. There's just a lot of tone in her adductor tendons so we just compressed into that tissue, and the tissue took me into its attachment point, into the rami where it was attached. And so we just followed that. And then I just got an intuitive hit. What if we compress the entire leg up into the joint? So I just put my hand on the bottom of her foot and compressed it in, and the muscle just went, "Oof,"
Love it.
right? So it's reading the body. I say the body has a story to tell. And it's our job to try to read that story so that we can best support the body in releasing that story from the tissues. And that's how I work with the body. And so Rick, I call myself the hardest working lazy person out there, because I don't like to work too hard. I don't like to think too hard. And all of my techniques are, does it move? How can we get it to move? And what does it need? And we're applying some pressure and following it and waiting for the release.
Yeah.
You
Yeah.
don't have to think so hard.
It's beautifully simplistic, but uh, so relevant and intuitive. I just love
Yes.
what you've put together. It's really
Um,
amazing. Yeah.
thank you. Yeah, and it's a lot of fun too for us as practitioners when we get those good releases, when
Yeah.
we and when you feel. And another big component of what I teach is helping our clients to feel what's happening in their body. Our body is constantly trying to give us impulses, input. It's trying to talk to us.
Yes.
And when, but our society has taught us to tune all that out. And so when I work with someone and one side moves and the other side doesn't move, I want them to feel that. Can you
Hmm.
feel how this side moves? Can you feel how this side doesn't? Does it feel different to you? I want them to become aware of that. And then when there's a beautiful release and the tissues have softened and we've gotten movement back in there, I want them to, one, try to feel the release. Oh, do you feel that happening? What do you feel? What do you notice? Like I'm trying to engage them to feel that release. And then when there's more motion in there, do you feel that? Because that's all helping them to get in tune with their body and to
Yeah.
feel the changes in their body.
Gosh, it's like talking to myself, listening to you. We both see so eye to eye on this. This is why I was so excited about your course and your teaching methods and your whole message and so forth. So I just love
Um,
it. I just love what you're doing. I really think it's the way, rehab is meant to be, is to help people understand what's wrong with their own body and
yes,
sense it. And we
yes.
should be able to fix ourselves in many
Yeah.
cases.
Well, and absolutely, and I think that, so we should just be guides, right? We
Mm,
should be guiding them
yep.
into, because, another point I want to get across here is that not all of our pain is physical. And that, I had an experience myself where I was having right side low back pain. And being a PT, I knew how to stretch, I knew how to try to mobilize, I was putting heat, ibuprofen, nothing was touching it. And so I went to my partner. Luckily now I have, so I work at the Center for Birth Healing here in the Boulder, Denver, Colorado area. And I have two other practitioners now working with me. And so I went to my practitioner, Jenny, and I'm like, Jenny, okay, I've got this right side low back pain. And she listens to the body and she gets drawn to my left kidney. I'm like, I would have never in a million years gone to my left kidney there, Rick. I'm like, okay. But as soon as she held my left kidney, I felt the connection into my right low back. And she helped me to tune into, okay, what's going on here? What do you sense? What do you feel? What do you notice? And it was just a guiding process that helped me to have a huge release. And I got off the table, back pain's gone, and I felt totally different in my body afterwards.
Lovely.
And
What do you think led to that kidney issue?
I have no idea. I mean, there was something being held in that kidney. So,
And by that you mean emotionally, psychologically, in some
yeah, so
way?
a visualization came to mind.
Hmm.
And a visualization that was related to, so this is really woo for some people listening in, but the right side of our body is our masculine. And the right side is either our putting our work out into the world or our relationship with men. Left side is that feminine energy, that receiving energy. And my right low back has always been my area of weak point, I guess you could say. But it's also about, I'm divorced, so been divorced for 10 years now, and wanting to find that right partner. And
Mm,
it was related to relationship with men, but it was being held in the left kidney,
mm,
and it was related to men and my relationship with men, and that's where I was just storing it.
mm,
If we look at it on an energetic, the kidney's fear. So
mhm.
some of it was around, fear of getting into another relationship and getting into the wrong kind of relationship with a man, so um, sometimes we can use the area of the body to kind of understand what might be going on for people. The
Mhm.
pelvis is a bowl in my mind, and different parts of the bowl mean different things. So depending on where there's tension, where people are holding things in that part of the pelvis might give us an understanding of what's being held there.
Mhm.
I a lot of times, Rick, there's a lot of trauma being held in our nervous system that is impacting the tissues of our body.
Absolutely. Absolutely.
And, I worked with someone who had a C-section, and she had lower abdominal pain from the C-section for 5 years. That her doctors went on and did two more surgeries to try to get rid of her pain. And when she came to see me and I just tuned into those tissues and we worked with what happened in that first birth and helped her to release the emotion that she was holding from that experience in her tissues, helped her to kind of reprocess the event, she left in no pain.
Mm, yeah.
So we need to understand that there's emotion that can be held in our tissue. There's trauma that's, they say pain is from the central nervous system, right? That our body, that our tissue, that pain is from that central nervous system warning signal in the body. But the body, that the area that the pain is being held in is the area of the body that needs attention. It needs help. It needs support. It needs guidance. It needs love. And when we can respectfully explore the area, we can get the answers, we can release what is being held in there, and everything just kind of
Hmm.
breathing again.
Yeah. Yeah. I absolutely agree. I'm on board. I've seen that myself in my years as well. I've got a few stories of that in my book that's coming out this spring too, about psychological issues manifesting as physical pain in the body. So
Ooh, I
um,
can't wait to read that. When's that?
yeah,
What's the name of it?
sometime this spring, but
Okay.
I haven't been told by the publisher yet. Apparently it's a secret. I guess I don't
Oh,
know. I'm only the author. Why should I know? So I
oh,
had
that's
another
awesome.
question for you. I find that there are a lot of myths and misconceptions out there swirling around different areas of our bodies, and one of those for me, I wonder if you have some either misconceptions about pelvic floor rehab or the pelvis in terms of housing these injuries, or Kegel exercises. I know that's that's like a buzzword. Everyone says Kegel exercises, and maybe you have, from your expertise, some different ideas about those as well.
Yeah. Basically, Rick, the current, you know, the current approach to anything in the pelvis is, oh, do more Kegels. Do more Kegels. Oh, you just need to strengthen, strengthen. Prolapse, you got to strengthen. Stress incontinence, you got to strengthen. Pelvic pain, you got to strengthen. Well, a lot of times there's too much tension, and strengthening is the last thing we need to do.
Mm,
And it's truly trying to understand, because when we're in pain, we know we tighten up, right? We tighten up because we're in pain. We're trying to, get rid of the pain. We're trying to avoid the pain. The other thing we need to realize about this pelvic space, especially vaginally, is that that is our sense of safety and security. And that if someone has been violated in any way, whether physically, emotionally, or verbally abused, that area is going to hold tension. It's trying to keep us safe.
mm,
And for us to just go in there and, either approach it with, well, you need more strength, which is not what you need. Well, you need to relax. You need to relax. Well, if someone's not feeling safe in their body, the muscle's not going to want to let go. And so what we need is to truly, what I like teaching is like, let's get curious with the muscles, with these tissues. Number one, let's never, ever, ever create pain when we're doing intravaginal work. So if you're listening in and you're seeing someone and it's painful, please go find someone else. Go work with someone else. I truly wish I could get my hands on every person who does intravaginal work and teach them how to respectfully work with these tissues. Because those tissues don't need pain. They need respect. They need to be listened to. They need TLC. They need love. They need attention. They don't need to be forced to do anything.
mhm.
And so, really, there is no blanket one thing fits all. We need to get curious and understand what's actually happening in there. If the muscles are tight and tense and we think we need to make them relax, what's making them tight and tense in the first place?
Mhm.
Let's go there. What if
Yes.
it is the bones are just out of place and all we need to do is help bring those bones together and they can relax? What if it's, I'm not safe in my body? And if I don't feel safe in my body, they may relax while I'm on your table, but as soon as I get up and go out into the world, they're going to tighten up again. And so I do feel that there's a different approach that this area of the body needs. And it needs a way more respectful approach. And, there's trainings out there, people learning how to do intravaginal work where they just put their finger right in the vaginal opening and that's kind of like, whoa, where'd that come from? So
Hmm.
I teach a way where we touch up at the knee and we connect in, and there's so many check-in points to make sure that a person's body is on board with doing intravaginal work and not just their head. Yes, I'm here. Okay, I know you need to do this. Okay, okay. And then they're disconnecting. That's not serving you. And as therapists, we need to know when someone's disconnecting from their body, and not force and do intravaginal work when they're disconnecting. We need to help them to stay connected to our touch, to what's happening in their body, so they can be part of the process. This is not something that should be done to you.
Right.
It's something that should be done with you. And so that, I hope that kind of answered your question.
Yeah.
Um,
I frankly, I feel that that's where it's not only for the pelvis, it's everywhere. Well, I mean, as therapists, we need to use that exact approach everywhere in the body rather than forcing things, because so
yeah,
often, a therapist might have two or three hammers, and so everything, that's what they do to everything. And gosh, no, I hear you.
yeah, yeah, I totally
You're
agree.
absolutely right.
I was just doing one of my interviews for the birth healing summit I do every year. And the doctor is doing, trauma informed care. And, so we're talking about what does that look like? And I'm like, isn't that just respectful care? Isn't that just respecting the person in front of you? You know, why do we need special training on this? And I think, her response is that a lot of people are dealing with trauma in their body, and the medical system has never trained us in how to work with that trauma in the body.
Hmm.
And I think that's where, I'm sure your approach and my approach is respecting that, or knowing how to sense and feel for that, so that we're not re-traumatizing someone, we're not adding to their trauma, but we're helping to minimize it and to release that trauma from their body. And knowing, really it is being that skilled practitioner of knowing when there's trauma and knowing when there's not. And treating the body, because there is a different approach when trauma is present in the body. And we need to know what to do with that.
Hmm. Yeah.
And I am one area of the body that holds it the most is the pelvic space.
I can believe that, because I know, for instance, every time I have a fear of heights, if I go next to a railing, the first place I feel that is in my pelvis.
Yes.
I'm just like,
Yes.
it's a sensing organ area
Yes.
almost, and that's, you know, I
That's
totally believe it.
safety and security
Yeah.
is in that perineum.
Hmm.
And the other interesting piece is that, this anus, the anal sphincter muscle, when it's excessively tight, that's usually around, someone, again, safety and security. But there's a massive correlation with tightness here and people who are OCD,
Interesting.
because that OCD, that everything has to be in its place, is part of their safety and security. That's what makes them feel safe and secure, is when things are orderly for them. And that can, whenever I find a ton of tension in this muscle without knowing anything about them, I ask that question, are you the type of person that likes to have things very orderly and neat and everything in its place? 100% of the time it's yes.
Mm.
So there's that, it's so connected. Our body and our tissues are so connected to really what's going on in us psychologically. And I feel like when we work with things from a head position, we're doing therapy and we're doing talk therapy. I think that's one level of healing, but I think there's a much deeper level of healing that happens when we incorporate the tissues of the body
Mhm.
with that. And I think
Absolutely.
we get a much deeper healing when we include the body and the tissues. Yeah.
Absolutely.
Yeah.
Well, Lynn, I love your message and I love your work. I just think it's so important, and it dumbfounds me that that not every woman gets a chance to experience this type of care and attention,
Yes.
given how many pregnancies there are in the world. So I know you're on a mission,
Thank
and
you.
I commend you for it. I think it's an underserved community, and hopefully this podcast reaches some people who may rethink the pelvic floor pain that they've been having, or pain with going to the bathroom, or other issues, back pain, what have you. So, and maybe they'll, if you've had an intuition thinking, I wonder if this has anything to do with my pregnancy,
Yeah,
2 months ago or 2 years ago or 20 years ago,
absolutely.
it's worth exploring and finding a professional like you who understands these issues so completely.
Thank you, Rick.
Yeah. So thank you.
Yeah, there's so many women in their 60s, 70s, 80s that are dealing with these issues. And when you ask them, when did this start? Well, after I had my baby.
Yeah.
And
Yeah.
so it is so connected and so related. And the biggest news or information I want people to know is it's never too late. Never too late to get help. And
Yes.
right?
Correct.
You
Yes.
can always make changes and good changes in the body. And so I read a study somewhere, and I'm not sure how they got these numbers, but it was a projection of the number of people that were going to have pelvic issues in 2030, 2040, 2050. And it was like astronomical, like millions, like 40% increase, 50% increase in issues, in 2050 and things like that. And I was just like, we could change this.
Mm-hmm.
We could totally change this by getting women the support right after birth.
I feel the same about chronic pain in general, that we can change this.
Yeah.
I don't feel that we understand it well. And so we have similar missions. So,
I agree. Great.
Yeah.
Rick, I have to have you on my podcast too. And we'll talk more about this. Okay.
Anytime. But how can people reach you, Lynn, if they want to learn more about you, products and so forth?
Okay. Anybody interested in wanting to do a session, and there are distant sessions, so I can do Zoom sessions with people if we're dealing with trauma from birth and issues from your birth. We can do things over Zoom. So that centerforbirthhealing.com is my website. No, it's under construction. We're revamping it and making it better, but you can still access the schedule now button there and book an appointment, whether it's in person or via Zoom. I have practitioners. Jenny's in Lafayette and Mary Jean is in the Boulder area. So please, seeing either of those two, they are excellent. I let them work on my body. I don't let anyone work on my body. So I only get the best, and these two are great. So seeing them is just like coming to see me. So centerforbirthhealing.com is the website for the clinical practice. And then instituteforbirthhealing.com is the educational platform of my business, where Rick took the online course, and we have live courses, online courses. There's doula course, there's a midwife course, there's courses for body workers, and lots more information on the Institute about this. So thank you.
And then you have a YouTube channel.
Yes. So the YouTube channel is instituteforbirthhealing.com, or Institute for Birth Healing is the YouTube channel, Institute for Birth Healing on Instagram. I do have a Facebook group, which is Institute for Birth Healing Community. So if you guys want to join that, there's both moms and practitioners on that group, and we're all sharing lots of great information and getting people support and help in that community.
Great. And then if they wanted to so they would reach out to you through the Institute. For instance, a patient would reach out to you through the Institute.
So if someone's
website.
wanting a session with me, then I would refer you to the Center for Birth Healing.
Center.
Yeah.
Okay.
Yeah,
All
but,
right.
and you can, but either way, reach out on the Institute or in the center, we'll get you covered, we'll get you the support you need.
Yeah, and
So,
Lynn's put out some great information, folks, just for you to consume at home, to understand her approach and her thinking, and to help you feel more comfortable, and really just to give you hope that there are answers
yeah.
to your
On,
questions.
yeah, on the instituteforbirthhealing.com are 2 free courses. The common postpartum patterns in the body is a free course anybody can watch. It's just more information. The sacral flexion pattern is more for practitioners. Well, actually, there's some things that you can do for at home for yourself too, if you feel like you have that pattern. So both courses are free on my website, so please check those out. Yeah, thank you, Rick, so
Oh,
much.
my pleasure. And then please send me that link to the YouTube
Yep,
video of how to correct the open birthing
yep,
pattern on
yep,
your own. That would be super. All
yes.
right. Well, thank you so much, Lynn. So much respect for what you're doing. And I really appreciate you coming on.
Thank you, Rick. Thanks for this opportunity. So appreciate it.
Oh, my pleasure. I'll talk to you soon, hopefully.
Yes, definitely.